Hi everyone, my name is Xinyi Liu, and today my presentation is on autism spectrum disorder, also known as ASD. ASD is a condition related to brain development that impacts how a person perceives and socializes with others. It can cause problems in social interactions and communication. Autism spectrum disorder include autistic disorder, Asperger syndrome, pervasive development disorder, and the childhood disintegrative disorder. In terms of signs and the symptoms, ASD usually begin in early childhood. Often children show symptoms of autism within the first year. We can see individuals with autism have problem with their communication and social interactions, including difficulty in sharing emotions, sharing interests with other people, or sometimes simply just carrying out a conversation with back and forth question answers. And we can also see restricted or repetitive patterns of behaviors. They might have repetitive movements, motions, or speech patterns, and they like to adhere to a specific routine of behaviors. And we might also see increase or decrease in sensitivities to specific sensory information from surroundings, and they usually have fixed interest or preoccupations. According to CDC, 1 in 54 children have been identified with autism spectrum disorder in the US, and this occur in all racial, ethnic, and the socioeconomic groups. More than 4 times more common it is among boys than among girls. 1 in 160 children has autism worldwide, and we can see this number almost triple than what is a U.S. incidence. I think that might have to do with their diagnostic criteria and their definition about autism. Autism is a complex disorder of central nervous system. While the cause of autism are still remain unknown at this time, the nature of the brain disorder appears to be a combination of genetic and environmental factors. There are some theories that have been suggested by researchers that are including prenatal inflammation in the brain and the neurotransmitter. So Johns Hopkins, their studies show that brain cells associated with central nervous system became inflamed in individuals with autism, and that is happening higher than in typical individual. And also this suggests that the cerebrospinal fluid demonstrated an increase in cytokine response in autistic individual than normal individual. And in terms of neurotransmitter theory, University of North Carolina School of Medicine, they suggested that the environmental conditions such as exposure to toxins can lead to problems in development of neurotransmitter system, especially in genetically susceptible individuals. Other theories are include genes and neurology. Like I mentioned earlier, we still don't know the cause of autism yet, but National Institute of Mental Health is supporting the Autism Genome Project, which is an effort to find the genetic and the environmental factors that contribute to the autism. And some ongoing research subjects include genes that make individual more vulnerable to autism, and the genes interactions, and submicroscopic anomalies, glutamate neurotransmitter system, as well as chromosome 11. And those studies are ongoing right now. The diagnosis protocol. So ASD can sometimes be detected at 18 months or younger. By age 2, a diagnosis by experienced professional can be considered very reliable. It is recommended that all children to be screened for autism at 18 and 24 months. And the diagnoses usually are made by their primary care providers or their pediatrician. And we also want to encourage parents and their caregivers to be involved in the screening process by utilizing some screening tools that are listed below. Because research has indicated that parents are a reliable source of information about their children's development, and evidence-based screening tools that incorporate parents' report can facilitate the communication between the parents and the providers. Screening children and providing parents with some anticipatory guidance, that is educating family adult what to expect in their child's development and how they can promote development and the benefits of monitoring development, and it can also improve the relationship between provider and the parents. So we encourage all the family members and caregivers, parents, to be involved in that screening process. Some differential considerations, because many other disorders do share the similar symptoms with ASD, which are include the Williams syndrome, Prader-Willi syndrome, Fragile X syndrome, Landau-Kleffner syndrome, Angelman syndrome, Rett syndrome, and the tardive dyskinesia. Therefore, a thorough screening and other tests done by their PCP and the pediatrician is crucial in making the accurate diagnosis. Some common medical comorbidities for ASD include ADD, ADHD, seizures, dental issue, sleeping disturbance, and their GI symptoms. So the effect of the disorder on an individual's functioning. Symptoms may improve with age and behavior treatment. But individuals with autism still experience increased risk of depression and other behavioral problems. There is a minority of adults with autism may go on to live or work independently. However, many still require continued aid or intervention. And some common effects for autism include problems in school, their employment problems, and their social isolation. Some available treatment for ASD. Although there's no cure for ASD, but therapies and behavioral intervention can help to improve the individual with ASD in terms of their functionalities and their quality of life. So educational and behavioral interventions, including behavior management therapy, cognitive behavior therapy, educational and school-based therapy, as well as occupational therapy. Medication-wise, medication cannot cure autism or even its main symptoms, but medication does help with related symptoms such as anxiety, depression, or obsessive compulsive disorder. So we can use antipsychotic medication for those individuals with severe behavior problems, and also anticonvulsant is for those experiencing seizures. Prognosis. Some children with autism may improve at age 4 to 6 years, especially those with mild autism and who have been treated at an early age. And these children who improve may be able to include themselves among other normal peers. However, results from the survey still shown that 49% of adults with autism still living with their either parents or caregivers. Only 12% of adults with autism have a full-time employment. And statistics also show that 25 to 70% of adults with autism have varying degrees of mental retardation. Also, people with autism are 4 times as likely to develop depression compared to the normal individuals. Early intervention yields better results. My literature review is done by Elder et al. So the topic is clinical impact of early diagnosis of autism on the prognosis and the parent-child relationships. So the researchers, they looked into 31 studies, and they conclude that among all treatment approach, naturalistic setting provides the best results. Naturalistic setting, meaning children's day-to-day environment, such as their home, their daycare, or their preschool. Basically, if the therapy and the interventions provide to the children in this day-to-day environment, they can help them to building and fostering a school or relational and communication abilities, and then they also help them to work on to enhance their developmental skills, including communication, adaptive functioning, and the growth gross motor skill and the fine motor skill, as well as their cognitive perceptual abilities. So according to the study, ASD intervention should be addressed related difficulties as well, including their comorbid conditions such as emotional dysregulation, GI disturbance. Maybe some individual might experience an attention deficit, hyperactivity disorder, or learning disability. So early diagnosis and treatment with evidence-based intervention can significantly improve the quality of life in the individual with autism. And again, in the study, they suggest that among all approaches, the naturalistic setting is the best approach, according to their statistics. And here's are my references. Thank you.